Welcome to America Salutes Its Veterans. Have you wondered what the changes in healthcare will bring to you? Well, I'll tell you what. We have with us today two folks who are going to be able to talk to you about how to access healthcare. One is Stephanie Radtke, and Stephanie works with the Minnesota Department of Human Services, and Stephanie is the Director of Healthcare and Eligibility, Healthcare, Eligibility, and Access. That is a mouthful, but that's a big job. Welcome and thank you.
Thank you.
And Milton Schoen, who is the Director of Hennepin County Veteran Services.
Thank you.
And you're going to talk about how veterans can get enrolled in the new healthcare program.
In VA healthcare.
Stephanie, tell us about this new healthcare program.
Okay, thank you, Judy. Well, as you said, I'm the Director of Healthcare Eligibility and Access, and our goal is to make sure that people understand their healthcare program options and, in fact, have easy access to Minnesota's publicly subsidized programs if those are the best choices for them. And we've had a lot of changes in this last year.
What do those changes mean for people? So you're saying people who are privately insured and now may not be privately insured, or any people?
Many people seeking healthcare coverage, and probably the most significant changes happen in our General Assistance Medical Care Program, sometimes referred to as GAMC. And you may be aware there's been a lot of newspaper articles and other interest in this program. And this is a program that is primarily for adults without children who need publicly subsidized health care. And the biggest change with this program is that now these people, if they wish to receive a comprehensive set of healthcare benefits and services, be able to see a doctor, see a specialist, have some coordinated care, need to sign up with one of our hospital-based delivery systems.
And how does that work?
Well, first, the people need to be determined eligible for the General Assistance Medical Care Program. And so there's a set of eligibility criteria, but they're generally quite low income people. So they need to be determined eligible at their county human services office, and then they can sign up for one of the hospital-based delivery systems. And right now we have 3 available delivery systems here in the metro area.
And they are?
And they are Hennepin County Medical Center, HCMC, here in Minneapolis.
So would you just call, go ahead, the other two.
Oh, sure. Then there's Regions Hospital in St. Paul and the University of Minnesota Fairview Hospital in Minneapolis as well.
So would you just call these hospitals, or how would I sign up?
You can sign up a number of ways. You can sign up at the county office as you fill out the paperwork and get determined eligible for the GAMC program. You can certainly contact the hospital as well. The hospitals are able to enroll people in their delivery system as well.
That is excellent. At least they have a place to go. Folks have a place to go. You hear a lot about what is going to happen to people, and is there any access to health care for people who at this time, you could have had a great health care plan, lost your job, and have nothing. And this is a way that you can access it.
This is one way, and but one thing that we're concerned about is that we believe there are a lot of people on the GAMC program and other healthcare programs who may in fact be eligible for veterans health benefits, and that might in fact be a better choice for them.
And so do you think that's so, that you have many veterans eligible?
Well, we've got data that says that there are hundreds of veterans in Hennepin County that are on public GAMC. And our job is to access health care for veterans, and we're there to remove the roadblocks to people obtaining health care within that VA system. We'll help veterans obtain their military discharge that they need for enrollment. We'll help them complete the enrollment, and we'll inform them about the service delivery, both in our county and other county veteran service offices, because we've got the Minneapolis and St. Cloud VA medical centers. We've got community-based outpatient clinics, and the service delivery is a little bit different in every county, so we ask people to check with their county veteran service officer, and that's what we do. The VA has some exceptional benefits. You're a customer for life when you're in the VA. that low-income individuals don't have any co-pays, so they're able to get their prescription drugs, their primary care, and get ongoing primary care, and the behavioral health services are some of the best available. We're fortunate as County Veteran Service Officers that we can get state dental and optical benefits for veterans also, so we can help people access both VA health care and state benefits at the same time.
Tell us how they do access it. I know that at the end of the program that we have many slides made for information for access, and also that every single county in the state has a veteran service officer, and
you know, I'd ask that, you know, if they're in Hennepin County, they can call our number, 612-348-3300. We've got the website for the Minnesota Association of County Veteran Service Officers that should be up, and they can find their County Veteran Service Office using that. We've got the Vets Linkage Line, and we've got that information up there also. And I think on the slide we'll also have information on GAMC if people want to apply for that, and to make sure that they have health care coverage, that they don't fall through the cracks, especially people who need prescriptions, if they need medications for diabetes, if they need medications, psychotropic medications and other medications. We don't want people not to have medications for a while.
Stephanie Radtke from the Department of Human Services, before the show you said, oh, one of my main goals is to make sure that people do not fall in between the cracks and that they don't wait. Talk about that for months.
Absolutely.
Yeah.
I think it's really important that people understand their choices and make the best choice available. And the best place to get that information is the local county human services office, as well as we have a lot of information on the DHS website as well, and I know we're going to have that up. But it's important that people apply at their local county human services office for Minnesota healthcare programs and see which option is the best for them. And in addition to GAMC, people with severe disabilities may also be eligible for medical assistance, which offers a real robust set of benefits. So it's important to understand those options and apply at your county office, but also, I think as Milt just said, apply with the county veteran service officer at the same time. So if there aren't any gaps, if you're a veteran,
right.
So,
but if you're not a veteran, you'll refer them where?
We'll refer them to Human Services in our county, to Eligibility Sports.
And in any county.
In any county,
right.
they will connect them to the public programs.
Right, right.
That's right.
You know, for our Greater Minnesota friends who are watching this program, what's going to happen in Greater Minnesota?
Well,
Are there any hospitals?
Right now in Greater Minnesota, there are not any hospitals who are participating as a delivery system for GAMC. Mm-hmm. So people in Greater Minnesota on GAMC have access to prescription drugs, as well as can visit local hospitals for care. But there may be better choices for them as well. So it's really important for people who have served to contact their local
And then take the last 10 seconds, Stephanie. What have you not said and that you have to say in 10 seconds?
Make sure to contact your county human services personnel, as well as your veteran services officer.
Absolutely.
And
we will access both VA health care and other state benefits for
And they get a hold of you by?
Calling Hennepin County Veterans Service, 612-348-3300.
And I want to tell you that this has been a short and a quick overview. There is so much to know. Please go to the websites that we have furnished to you. They're so very, very important. And make sure that you call Hennepin County or any county for information for this. Thank you so much.